Hey guys, welcome to another episode of Concierge Doctors of Scottsdale podcast. I'm your host, Dr. Mike Gonzales, and my co-host here, Dr. Linnea Felton.
Hi guys.
So today we're actually gonna do kind of a episode 1 of a series on weight gain, and some of the causes of weight gain and some of the ways that you can prevent weight gain and help with weight loss. So today we're actually going to cover thyroid health and thyroid disease and disorders that contribute to weight gain, to fatigue, to overall just feeling ill. So Dr. Felton, if you want to take it from here, we'll get this conversation started.
Yeah. So a lot of patients that come in to see me, primarily their major reason is desired weight loss. And so they've been struggling for a number of years, or even within the past year, they'll say, I've gained a ton of weight and I need some help. I've tried all the dieting things. I do a lot of exercise. Please help me. I don't want to do the diet pill stuff, or even if they've had done that in the past too, it's not working, something's wrong. And our job is to figure out the cause of what's happening. And so, kind of part 1 of where we'll start with this is the thyroid gland, like Dr. Mike mentioned. And this is a little butterfly-shaped gland in the front of your neck that's primarily responsible for metabolism. So when you'll come to a naturopathic doctor, or even some MDs or traditional medicine docs will do this as well, where they'll start to feel in the front of your neck for tissue changes. And basically how I describe it to patients is that I kind of feel down their windpipe or their trachea to see, when that tissue change happens, where it gets a little bit more squishy. And then I'll go underneath their front neck muscles here.
Why don't we just show them? You can show them on me, and you can keep talking in the mic, but okay. I'll just turn towards you.
So I kind of do it 2 different ways here. So I'll go kind of down the front of the trachea of the windpipe here, and then I'll start to feel the tissue change where it gets a little bit squishy right here. Go underneath, so I'll have you tuck your chin just a little bit. Good. And that kind of relaxes this neck muscle here. I'll go underneath that neck muscle with my fingertips to kind of feel any tissue changes here. And primarily what I can appreciate from, feeling from the front side of the neck here is any sort of enlargement of the thyroid gland. And that, we'll kind of get into a little bit here, but that can be due to over or under functioning of the thyroid gland. And I'll kind of repeat kind of on the other side here. And then usually what I'll do is I'll have you swing your legs that way. And I'll tuck your chin again. Good. And then what we'll do is just kind of press the thyroid gland with my right hand here, and then push on the gland that's pressed into my other hand, and repeat on the opposite side. Cool. Basically what I'm doing there is checking for any nodules. And so nodules can be, basically to me, it just feels like a piece of rice or even like a pea. Sometimes if it's pretty big, can be tender to people, cannot be tender to people. This is just, okay, if I find something like this just kind of gives me more reason to send people for an ultrasound to see if there's a nodule there that's causing these kinds of symptoms. And, it can be some sort of benign type situation that, typically people will have some thyroid nodules that are benign and not really doing anything. They might be altering the thyroid hormone production. Or sometimes it can be a sign of more of a malignancy or a cancer type situation. So that's why our physical exam of that portion of the gland is so important. Just so we can pick up on these things pretty early, send people in so you can figure out kind of what's going on. But that's more the scarier side of things. Typically, I do not feel these nodules. I do, occasionally I will feel them, and that just, again, gives me more reason to figure out kind of what's going on, more so with imaging stuff.
Yeah, and a lot of times with, when you have issues with the thyroid, some people will kind of say that they have difficulty swallowing. And, yourself, if you palpate your own thyroid, you may feel, if you do have a nodule, you can feel that on your own. But getting it looked at by a professional obviously is the best thing to do. And so after describing kind of where the gland is and what can happen with it, we can kind of move towards, all right, what's its function primarily in the body? And so the number one function for thyroid, of the thyroid, is to pretty much regulate metabolism. And that's how it contributes to weight gain or weight loss. So if you want to explain a little bit on
Yeah.
that.
So with the thyroid, there's a couple different components here. Since it is a gland, it requires some communication with the brain. And so we have three different components here. We have the hypothalamus, which is located a little bit higher in the brain than the pituitary, that looks like a little stalk in the middle of the brain, kind of behind where your eyes are, a little bit further back. And then we have the thyroid gland. So the hypothalamus is basically like the grandmother, and then the pituitary is the mom, and the thyroid is the kid. And these three components need to be in perfect communication with each other in order for the thyroid gland or any other gland in your body to start to cooperate and do its own thing. If there's any sort of miscommunication, that's where things can go awry, and that's kind of our job to figure out what's going on, how we can best support those three features, and figure out how to make you start feeling better pretty quickly here. So the hypothalamus that's the part that's highest up in the brain, will start to release something called TSH releasing hormone, or TRH. And basically that will talk to the pituitary, that then releases its own hormone called thyroid stimulating hormone, or the TSH portion of that. And then that will talk to the thyroid. From there, the TSH will start doing, with the appropriate support of some nutrients that we'll touch on in a little bit here, will start to support the conversion of the thyroid hormone itself. And so we have T4 and T3. T4 is T3's mom in a case. And T4 needs to convert to T3 in order for T3, which is the active part of everything, to be able to kind of do its job and be active in the body to help with the metabolism. Without proper conversion of T4 to T3, that's when people start to notice some issues here.
So just to clarify, so the hypothalamus sends a signal to the pituitary that then sends a signal to your thyroid gland that releases T4 and T3. And so these are the hormones that activate the cells and increase metabolism. And so T4 is an inactive form. T3 is the active form. So T4 converts into T3. So just a little clarification.
Yeah. So T3 will then kind of do its job throughout the body. But I will say there are two different options that T4 can go into. And so normally in a perfect world, we want it to go to T3 so that it can kind of do its job, like I was mentioning. But there are some instances where it can go to something called reverse T3. And that will be important as we kind of discuss some of the symptoms that people have and how we start to investigate these with labs.
Yeah, so I think that's a good segue. So for symptoms, typically when we see patients come in with issues with their thyroid, some of the typical complaints are, obviously number one is I'm gaining weight and I don't know why. I'm fatigued. I feel like I can sleep all day for hours on end. My hair's falling out, and I have cold, or I'm cold all the time, even when it's hot inside the house or outside. I'm still kind of cold. I need to carry a sweater with me everywhere. My skin is really dry no matter how much lotion or moisturizer I use. And constipation. So constipation is another really big one. So if you're not having regular bowel movements or your difficulty straining, and you have all these other symptoms, then it might be time to get your thyroid checked. And so, this is the typical presentation. They'll come into the office and say, look, I have all this. And right away, it's like, okay, we need to investigate the thyroid, because that's how big of a role the thyroid has on pretty much your energy and all these different aspects of your health. So yeah, that's a typical presentation.
Yeah. And I also see with women with some irregular menstruation or periods too. It'll either be way too short or way too long. And I do see some depression that's associated with that too. So you kind of see how many symptoms that people can have. Certainly don't need to have all of them, but it just kind of gives us reason to say, all right, if they have these symptoms, this is definitely something that we need to check out, because it could just be as easy as giving the thyroid the support that it needs to appropriately function.
Yeah. Yeah. So then I guess the next thing to talk about would be, all right, well, how does this happen? How is my thyroid not working appropriately? What's causing this? And so there's several different factors for hypothyroidism. One being either a lack of iodine or lack of minerals that support the thyroid function. Another one would be either high stress is one of them. So if you're in a high stressed environment, then your thyroid is overtaxed and not necessarily performing as it should. And the last one, and one of the more common ones, is Hashimoto's or autoimmune thyroiditis.
Yeah.
And so that's definitely another one to look at. And, there's certain tests to test to see if it is an autoimmune issue. So just briefly, autoimmune meaning your own body, it has developed these antibodies against your thyroid gland. And so your immune system is attacking your thyroid. And this is what's causing the lack of production of these hormones that help boost your energy or create the T4 and T3. And so really, getting down, figuring out what is causing it, and then addressing that cause. And a lot of times people can get better results and lose weight, and a lot of these symptoms kind of go away. But
yeah, and we have some medications too that are related to kind of suppressing the thyroid a little bit too. Like some high blood pressure medications can do that. Lithium, for example, which is used to treat bipolar disease, and then a number of other different ones too. And so making sure that your doctor knows exactly what you're taking, the dose that you're taking it, and the reason that you're taking it for will kind of help them determine if there needs to be some additional testing to figure out, okay, are these symptoms related to thyroid? Is it the medication that's causing it? How can we put this whole picture together to figure out the cause of what's going on here?
Exactly. I guess the next thing would be, so we're talking a lot about a hypothyroid condition. I want to just touch on the hyperthyroid condition. So there are instances where this is all opposite. And because, our goal of this podcast is weight, where's the weight gain coming from? We're kind of focused more on the hypothyroid. But just to touch base, there is an opposite. It's called hyperthyroidism. And that's where your thyroid can produce excess hormones. And so this is pretty much an opposite picture from a hypothyroid state. So you'd be tend to run more hot. You'd have way too much energy. You'd have loose stools. So things like, it's like an intense energized state. And that can be caused, again, by several different factors. And one of them being autoimmune disease as well, which would be Graves' disease. But like I said, we're going to kind of steer away from that and talk a little bit more about hypothyroidism. So once you're diagnosed with hypothyroidism, we'll figure out the cause. Is it a micronutrient issue? So there are a few micronutrients that play a role in thyroid, and a lot of these micronutrients we help to support people with hypothyroidism. Regardless of the cause, you want to make sure that your thyroid is functioning properly, and in order to do that, it needs the proper nutrients or key nutrients. And so Dr. Felton will kind of cover some of those and their role in thyroid health.
Foundation of nutrients that we need for thyroid are especially zinc, selenium, and iodine. Those all contribute in some way or another to proper conversion of the thyroid hormones so that it can act appropriately. And so kind of just as a baseline, we'll make sure that you're getting that through your diet or through a multivitamin, or even through a separate supplement that just has, either those components or something like that in them, so that the thyroid can be supportive if we see on labs that it needs some support there. We can also test these levels through the blood as well. And so we, sometimes I'll do some testing with serum iodine, which basically just means the iodine that's in your blood, very heavily influenced by diet. And so day to day, it'll differ depending on how much iodine you get in your diet. Americans, we tend to get quite a bit of iodine through the iodized salt that's put in our food. So typically iodine deficiency is very, very rare here, but I have seen it. And then we can test for zinc as well and selenium, and we just make sure that you're getting that through your diet in different ways.
Yeah. And so the role of these nutrients, again, if you're not getting enough iodine, then that could potentially damage or reduce the function of your thyroid gland. So the role of iodine is essentially to create more thyroid hormone, and that's what helps with your metabolism. The role of zinc is to help, kind of configure those hormones together, and again, so it's all in there are certain cofactors in these biological mechanisms that are required in order for it to happen, in order for the hormone to be produced. The role of selenium, on the other hand, is to support the conversion of T4, which is the inactive form of thyroid hormone, to T3, which is the active form, is what you need. And so while we're on this topic, let's talk a little bit about the labs that we kind of look at for thyroid health.
Yeah. It's well known kind of in the conventional medicine track, the role that thyroid has on people's health and their metabolism, these kinds of things. And so typically what MDs and even some other DOs or these kinds of people will test for is just TSH alone. And kind of going through the path that I discussed previously with the hypothalamus, the pituitary, and the thyroid, there's a lot of components there. And so just testing for one piece of that puzzle, and if that piece of the puzzle isn't normal, then they'll usually, excuse this to being another reason that's not the thyroid underfunctioning. But as naturopaths, we typically test for more than that if we're concerned that the thyroid is causing an issue there. So what we typically test for on what we like to call the thyroid panel, just because it's easier just to kind of throw that term out there, is TSH. We test for free T4, which is unbound, totally usable, again, the inactive form, but it kind of shows what's unbound to a protein molecule that's traveling through your blood and delivering that to be converted to T3. And we also test for free T3, which again, unbound, active version, what we want to see. Sometimes we'll test for reverse T3 as well. Reverse T3 is important because, like I said before, T4 can go to T3 or reverse T3. In an instance where that reverse T3 is high, and this is where that lab value is helpful for us, that means that there's some sort of issue in the thyroid gland that's due to high stress. And so then we can kind of say, what can we do for stress reduction in this patient? How can we work together to figure out kind of what would work best for them in their schedule and their life to help decrease some of the stress so the thyroid can act like it needs to. And then we see that reverse T3 level going down, that free T3 level going up, and their symptoms will start to resolve. That's just one component of it, just touching on how stress can be a part of that. If a patient has any family or personal history of autoimmune conditions, including but definitely not limited to celiac disease, lupus, rheumatoid arthritis, the list kind of goes on, we definitely test for Hashimoto's, which Dr. Mike was explaining is that autoimmune portion of what hypothyroidism is. And with that, we test a couple other things in addition to that TSH, free T3, free T4, and that reverse T3 sometimes. We also test for thyroglobulin antibody and TPO or thyroid peroxidase antibody. Those antibodies are directed towards the thyroid that are produced by your body, like in any autoimmune condition. The body's producing antibodies against your own tissue, and that causes havoc, essentially, in the body with the thyroid gland. If those values are high, that's more or less confirming that there is a Hashimoto's type situation that's happening here. With Hashimoto's, it can be a little bit weird sometimes because sometimes it can start as actually being overfunctioning overfunctioning thyroid that leads to underfunctioning thyroid. And so you can kind of think of it like there's this really crazy war essentially that's going on with the thyroid. The body's attacking it. The thyroid fights back by going, full out, guns blazing, trying to figure out what this is, pushing out all that extra thyroid hormone, and then it just gets exhausted. And so then you get more of that typical underfunctioning component that you see here with the Hashimoto's picture.
Perfect. Yeah, just to kind of go over the labs again. So, conventionally, when you go into a doctor's office, they test you and they want to look at your thyroid, on a basic lab test, they're looking at only TSH. And so that test kind of tells you where you stand, but it doesn't necessarily tell you, if your thyroid's functioning optimally. So it's only half of the picture. And so, you can get a TSH lab that comes back and it's within the reference range, but you're still feeling like crap. You're not getting, you tell your doctor, look, I still don't feel good. I'm still fatigued. I still have constipation issues, or you're still having some of these symptoms, and they see your TSH and it looks normal, so they kind of brush it off. But the thing is, we like to get the full picture, and that's by seeing, okay, you might have a normal functioning TSH range, but you're either the free T4 is low or the free T3 is low. So maybe it's you're not getting the conversion right properly.
Mm-hmm.
So looking at these free T4, free T3 allows us to see what's in the bloodstream and what's actually communicating to these cells to help regulate that metabolism. So just getting that full picture really helps us figure out and get down to what the actual issue is with your body and with your thyroid. And then you kind of started talking about Hashimoto's.
Mm-hmm.
So that's definitely another cause of hypothyroidism. Again, it's an autoimmune condition. Your body attacks the thyroid gland, and then you start to have these symptoms. You start to get some weight gain, some fatigue. And so looking at antibodies that are specific to Hashimoto's and figuring out whether that's an issue or not. And so after all this, after looking at all the labs, now we start talking about, okay, what's the treatment?
Mm-hmm.
And so that's what we'll get into here. And so first off, we'll talk about the treatment for
Mm-hmm.
a patient that's not Hashimoto's. What
Okay.
what would we kind of do for that?
So with a patient that's hypothyroid, meaning this is kind of basically what their labs would look like. The thyroid, hypothalamus, pituitary all operate on a feedback loop. And so TSH would be high, meaning that the pituitary is screaming at the thyroid to produce more hormone. That T4 might be low, that T3 will probably be low. That gives us a picture that the body's already kind of panicking, that this isn't happening the way that it needs to, and so we need help here. There's a couple options for what's going on. If we decided to run those antibodies and they're negative, which is the picture that we're talking about here, we can give patients some desiccated thyroid gland, which basically means that it's pig-derived. It's a prescription medication that you can get from your doc, and there's varying levels of kind of, depending on what your labs look like, what the dose is that you would start.
Mm-hmm.
Always to be dosed on an empty stomach away from other food. Some practitioners say to do it in the evening. Some practitioners say to do it kind of first thing in the morning, 30 minutes before you eat. We're typically of the mindset that we do it kind of first thing in the morning just so that it's more of a regular type situation. But if your body's having it just takes more time for it to convert to that T3 on that medication, then certainly we can do it at night, give your body the entire evening while you're sleeping to start to do that conversion, and then in the morning be ready to go. So that's one example of what we can do. There's also compounded pharmacies that we can do some of the more synthetic type thyroid medication with doing, varying levels of T4, T3 in one medication that you'll just take. Same situation. First thing in the morning, typically for most patients, 30 minutes before eating.
Mm-hmm.
There's also some times where we can just give just the T4 if that's the issue there. If that is significantly low, supplying that will lead to proper production of T3, we can do that too. If both of them are really significantly low, we can give both T4 and T3. Just to, as separate medications, we can just give that to the patient and they'll start to notice that. The T3, since it's active, requires less dosage. So typically we'll give them, they come in increments of 5 milligrams of the T3. So we'll typically give them what seems to be a smaller dose because it's that much more powerful.
Mm-hmm.
I will say I have some patients that are just on T3 and they do really great with that. So it really just depends on kind of where your labs look like. If we decide that they're significant enough, we need to go the medication route, we can do that. No problem.
Yeah. So, first of all, we figure out what does your body need. So if it's just either the micronutrients that are required to produce thyroid hormone, which would be maybe you just need some more iodine, maybe you need more zinc, you need more selenium to help produce that, then we'll go that route.
Mm-hmm.
If we feel like your labs are low enough and you need the support of a medication, then we'll go into the medication route, and then we'll figure out, okay, do we use a desiccated form, which is the more bioidentical form, or do we use a synthetic form? So that's all dependent on what your picture is. And now I'm sure some people will ask, can I take a natural thyroid medication, but can I come off of it? And I think that's something that a lot of people ask. And so
with these medications, they're typically not lifelong, but they can be. And I know that's really kind of a super vague answer and not probably really appreciated because well, what about me? Well, then that's kind of where it comes in with more of the individual. Can we kickstart your hormone with just giving this kind of short term, or is this something that needs to be more lifelong? There's some patients that do get their thyroid gland removed, and obviously that means more of a lifelong type thing because you have nothing being produced in the thyroid gland because it's not there. And so kind of giving them that thyroid medication throughout the rest of their life, they'll be able to have a normal metabolism, if you will. Some patients are just, we do the thyroid medication for a while, try to get them off, or for whatever reason, they decide to try to take themselves off, see how they do there, and it doesn't work. And they kind of go back to where they were.
Yeah.
That's another instance.
Yeah. And I think a big component too is lifestyle. So obviously our main goal is that you feel better right away. We don't want you to suffer any longer with weight gain and fatigue. So we'll give you the medication, but at the same time, we address the lifestyle. So what are the things that we can do for the long-term health of that thyroid gland? And so over time, we'll give you the medication. We'll start implementing these changes so that your body can start to heal and take over. So the medication, for some people, we kind of look to it as a support for the time being, to give that thyroid gland a rest and time to kind of recover in a way. And then once your body's ready to take over management again, then we slowly taper off the thyroid medication and see if your body's ready to handle it again. And sometimes, like Dr. Felton said, is sometimes patients require a little bit of thyroid medication in order to keep going. And then there's those cases where everything was perfect. They put in the work, the lifestyle changes. And the other thing is they addressed it at the right time. They went to see their doctor when they started feeling bad. And so they were able to catch what was going on right away with a good doctor with all the right labs. And so they were able to catch it on time and implement these changes. And then, they didn't need the medication long term. So it was just a temporary kind of like a kickstand or a support or a crutch in a way. And so, these cases vary. And so that's one way we would look at it. The next condition we'd kind of handle or treatment or look at treatments for would be the Hashimoto's picture, which is the autoimmune thyroid condition. And so if you want to kind of cover some of that, how would we treat a patient with that?
So with Hashimoto's, we definitely don't want to give, in this instance, a desiccated type medication or a gland that's from another source, like the pig. Because what's happening is the body is recognizing any sort of thyroid gland to be foreign and that we need to start attacking it. And so giving patients a thyroid gland that's essentially the same thing from another animal source will just result in worsening of disease. And so we definitely don't want to do that. And so with these patients, we do more of the synthetic route there. One of the best, acting treatment plans that we can give for a Hashimoto's patient is to start with totally 100% gluten-free diet. The reasoning behind that is they've found kind of in literature and some different studies, both mouse and human, that the thyroid gland and gliadin, or the protein component of gluten, are what we call molecular mimicry, or they both kind of resemble each other. And so the body might get confused. It's almost like the body acts like it doesn't have any glasses on. And so it kind of sees that as, okay, this shape kind of looks the same as this shape, and I don't like this shape, so I'm going to attack that one too. Essentially the same thing that's going on in an autoimmune condition like Hashimoto's. And so when patients are ingesting that gluten, the gliadin protein portion of that gluten molecule looks like that thyroid gland, the body will start to attack that gluten and will start to cause worsening of symptoms. And so by taking people off of gluten, you've eliminating that possibility of molecular mimicry or that worsening of the autoimmune condition. And patients will start to see, they might start feeling better pretty soon. They'll definitely see those lab numbers start to decrease. And so we can kind of watch the antibodies slowly start to go down. The conversion of the thyroid hormone gland will start to regulate as well, usually in conjunction with other treatments. But this is kind of where we like to start with people.
Yeah. So again, so the gluten looks similar to the thyroid gland. And so your body starts, not only does it attack the gluten, but it starts to attack your own thyroid because of that similarity. And so the main thing for these patients is to get them out of that inflammatory state. Their body is responding to foreign invaders or things that it thinks are foreign invaders, and it's causing havoc on the immune system, and that's attacking your thyroid and essentially causing this hypothyroid state and all of these symptoms. And so, when it comes to lifestyle medicine, the first step is, the very first step is, all right, let's give them the medication they need to feel better, to support the thyroid. And then again, it's addressing that lifestyle aspect. Let's take out all the things that are producing inflammation in my body. And so the number one thing, again, is gluten, because it's so similar. And then after that, we look at other foods that might be contributing to that inflammation. We look at environmental factors that might contribute to that. Say if you're exposed to several heavy metals, or if you're drinking contaminated water or pesticides, things like that we're exposed to daily. We try to eliminate them again, so that the body has less of a burden and it's able to heal itself, essentially. And so for the patients that do have Hashimoto's, what are kind of some of the results that you see with that symptom picture?
So I mentioned a little bit of this before. We can definitely look at lab results and see those numbers going down, but I don't treat labs for the most part. I treat the patient. What's going on? Labs will give me definitely a type of guide for the journey that we need to go on with people, but definitely what the patients are experiencing is my go-to. Okay, we did this treatment, works in some people, not working in this patient. What else can we do here? So with patients, starting right off the bat, if their antibodies aren't too terribly elevated, but they still are out of range, we'll do the gluten-free route. And for some patient, that's the answer. Then their symptoms are resolving. They feel much better. They're starting to lose weight. Their hair is not falling out as much. It doesn't feel as brittle. Their nails are starting to change. Their period is becoming more regulated. They aren't as temperature sensitive anymore. They don't have to apply as much lotion. Whatever their symptom picture be, they start to notice that this starts to improve.
So the patient doesn't even, in some cases, the patient doesn't even need to go on a medication, right. And that's dependent on the lab value.
Right.
And so if they look at your labs and you are hypothyroid, according to the TSH, the free T4, free T3, and then they look at the antibodies and say, oh, these are elevated. Depending on the severity of all of these labs, we can say either, all right, maybe we don't need a medication, but let's lower that antibody level down. And so that's kind of what she's getting at, is that we address the inflammation only without incorporating a medication, and then you see these massive changes or improvements. The antibody levels go down, the thyroid hormones go up, and then the patient starts feeling better. Right. So that's one scenario is what you're...
And then we can kind of go another step further. If antibodies are quite high, are starting to get towards, being extremely elevated, then we'll do always with every patient that gluten-free diet if they don't come in on that already. Some people are already heard about this approach to treating Hashimoto's. And so I would say a majority of my patients kind of have already come on this diet, which is awesome. Kind of helps us guide what we want to do for our journey there. And then we'll start doing more of the medication stuff, more of, hey, let's get your sleep back on track. Let's figure out kind of what other aspects in your life that we can help improve to help release some of that stress for you. And so then, gluten-free diet, we have the thyroid medication on hand. Sometimes even further, we'll even do things like some other inflammation modulator type approaches that might be pharmaceutical. Definitely approaching things with diet and herbs and these kinds of things. We can approach it that way too, just kind of giving whatever that person needs from our arsenal, however we can kind of walk through this. And so patients will say, I tried the gluten-free diet stuff, not really seeing too much of a change. Do we have other places to go? Yes, let's try the medication stuff. Okay, I've done these two things. Sometimes, I'm not really noticing too much of a change. Do we have other places to go? And they're so used to hearing, no, this is it. This is as good as you're going to feel, or whatever variation of that. And kind of what's in the research now, we have a lot of things that we can do. And so kind of what I'm getting at is with our arsenal, with what we know, with the herbal studies that we've done with some herbs that kind of will help build the thyroid gland, we can help, kind of incorporate those into treatment regimen, and then even going further into other necessary pharmaceutical interventions that don't have too many side effects, but really help to, again, decrease those numbers and help to improve symptoms, whatever the patient needs, essentially.
Yeah, guys. There's so many things that can be done. You know, we're not just, again, the thyroid labs are very important. We're looking at those, but we're also addressing and assessing the entire patient. So if that means your vitamin D level is suboptimal, we make sure that you're getting enough vitamin D. We have other supplements like fish oils to get you out of that inflammatory state. We make sure if your gut health isn't, properly managed, say you have a food allergy panel done and everything is coming up, well, we make sure that we address that food allergy panel, we address that inflammation that's happening in your gut, and then we incorporate things like probiotics, which actually some studies suggest there are microorganisms or bacteria that help convert T4 to T3, so that can have an effect on the thyroid gland. And then again, it's like we look at botanicals after that, and so there's just so many things to look at, and in your lifestyle and throughout your total labs, looking at the diet as well. If you're eating way too much sugar, if you have high cholesterol, diabetes thing, so everything we take everything into account, and we kind of manage it all together and make sure that you're optimal in all areas. And a lot of times people just over time, their body knows how to correct itself. Your body wants to be in the best shape for you, and so it starts to realign. It starts to come back together. So I think we covered quite a bit of information. Again, after the goal, I guess a quick summary would be figure out if your thyroid is the issue for your weight gain, because it's a very important thing to look at for weight gain and fatigue, hair loss. So figure out if that's the issue. Then figuring out, okay, what is the cause, whether that's a micronutrient deficiency like iodine, selenium, zinc, or an autoimmune issue like Hashimoto's where gluten is an issue. And so figuring out the cause. And then after that, supporting your thyroid with all the things necessary, with looking at your entire lab list, making sure you're getting all your micronutrients in, and you're getting on an anti-inflammatory diet. And then after you do all that, after you address the stress aspect too, the mental emotional plays a huge role in the thyroid function. After you address all that, then that's when your body starts to come back together, and you can, weight gain isn't an issue anymore. Your metabolism starts working again, and so you start feeling better, you start being more vibrant. So I think that's pretty much it for today's episode on weight gain, the true causes of weight gain. Was there anything else you wanted to add?
So even just talking about the thyroid, we went into pretty extreme detail in how we can approach these kinds of things. And Dr. Mike started off this chat with saying that this is going to be a series just on weight gain alone. And so kind of understanding that there might be more than one reason why weight gain is an issue. Typically, I do see patients where, yes, it is thyroid, but it also might be something else that we'll cover in a later talk. So, if this doesn't seem to be your symptom picture, or you have been told that there's a thyroid issue in the past, then that's certainly just something to consider kind of going forward as we continue with this series, that there might be something else at play here as well, in addition to having a thyroid condition. So just important kind of, bring your concerns to your physician, and we'll do our very best to figure out what the cause of your concerns are.
Yeah. And we could give you a little sneak peek. So some of the future episodes on the true causes of weight gain, we're going to look at male and female hormones, so estrogen, testosterone. We're going to look at adrenal health, so cortisol being an issue with some of these things. And then we're going to look at insulin and its role on weight gain. So those are just some of the things to look forward to. We're going to try to cover as much as possible and kind of cover the things that we see most often. And a lot of times, guys, the hardest part is identifying what the cause is. After that, I feel like it's not hard to start incorporating changes and supporting the body to help you lose weight. Thank you for tuning in, guys. If you have any questions, please comment below. You can reach us on our Instagram at Concierge Doctors. And if you don't want to leave a comment, then just DM us directly on Instagram. And And yeah, so thank you.
Take care, guys.
See you guys.